Good afternoon. My name is John Carricker. I'm a student at Eastern Kentucky University. I'm studying psychiatric mental health. I'm here to discuss integrative review of 4 studies regarding the effectiveness of pharmacotherapy in addition to psychotherapy, such as cognitive behavioral therapy and interpersonal therapy, compared to the effectiveness of just pharmacotherapy by itself. This is related to the treatment of depression. Depression is a very crippling disease that affects nearly 1 in 10 Americans. It can lead to chronic illnesses such as cardiovascular disease. You see increased occurrence of diabetes, obesity, and cancer. It can also affect many people around the person who is being affected by depression, such as their family, loved ones, and coworkers. So it's very important to discuss the best treatment options to help a person suffering from depression. Also, very interesting to note, according to the CDC, about an untreated or improperly treated bout of depression can lead to more depressive episodes. One bout that's not properly treated increases the risk of another depressive episode by 50%. So it can also, if not treated properly, lead to a chronic health problem involving depression. The 4 studies I looked at are all level 2 and level 3 studies. 2 of them were randomized and 2 were non-randomized. They all involved inpatient settings, except for one. One started out inpatient and led to outpatient settings. And that was a long-term study that involved 5 years. The one study also looked at comorbid substance abuse and the effectiveness of using pharmacotherapy and psychotherapy. These studies all compared 2 different groups, one receiving just antidepressants, medications, and the other receiving the combination of the 2 treatments that we're discussing today. All of these studies did find that the combination of pharmacotherapy and psychotherapy proved to be much more effective in reducing depressive symptoms of an individual. But not only that, but it reduced the depressive symptoms and improved their quality of life much more quickly than if they just received pharmacotherapy pharmacotherapy by itself. So these 4 studies did prove that the combination of these 2 treatments can be helpful for a person. It can reduce the risk of chronic depression by reducing the symptoms and allowing the person to get back to their way of life. I felt this study was important because I work with depressed kids, and a lot of times you see, parents or the patient, they just want to be given a medicine and just not have to worry about anything else. All they want is just the medicine, not put in the time and effort to really help themselves or find the root of the problem. Other patients are very afraid to take antidepressants, just the concerns that they have as far as side effects, things like that. So I wanted to show a study where it would be helpful to teach people, the best option for them as far as relieving their depressive symptoms and helping them work through this. I feel that education is the most important thing. That's the intervention I want to discuss, that educating your patient at the very beginning of their treatment is what the best option is for them, giving them the control of their treatment, helping them work through those things, I think gives them an extra motivation or the faith that they can get through this, which is very important for a person. So the education of the patient is the key. This can be done in an outpatient setting. It can be done in an inpatient setting throughout their treatment. I think as far as the fact that you do this at the beginning of the treatment to help them understand and guide them is the most important thing. So that is my review for the day, and thank you.